Good afternoon, and welcome to the Quest Diagnostics sponsored webinar, SOAP Notes on the iPad. My name is Colby Dix, and I will serve as your moderator and host today. Today's session is intended to be brief, but very informative, and we're excited to have you all with us. Our overall agenda for today is on the screen for you now. We'll dive directly into the video presentation shortly, and there will be a Q&A session directly following. Please also stay with us for a brief overview of Quantum's healthcare IT portfolio to close out the seminar. I'd like to extend a warm welcome to our presenter today, Justin Killebrew. His bio is up on the screen now, and you can see that we're quite lucky to have him available to us. He can navigate the Quantum EHR mobile app on the iPad expertly, and will certainly be serving up a lot of valuable points for us today. And with that, I welcome Justin, and we'll dive right into the feature presentation.
Thank you, Colby. As he mentioned, today I'm demoing the Quantum EHR and how to write a SOAP note on the iPad app, and hopefully show you how user-friendly it can be. Now, Quantum EHR is cloud-based, so it provides full mobility for securely accessing patient information from anywhere, anytime. So let's get started. When you first sign in to the Quantum EHR app, there are several different ways to pull up a patient. You can click Notes in Progress to open an existing note, or you can click on the patient's chart on the right side of the screen if the patient has been opened before, or you can simply type the name of the patient in the search bar at the top right. It's very simple. Once you have the patient up, click on the Clinical Notes tab on the left panel. You can tap on a note in progress, or for this demonstration, I'm going to click the plus button to start a new note. First, it's going to ask which template you want to use. As you may know, Quantum EHR has many pre-built or master templates available that you can easily customize for your own practice's unique workflow. For instance, if you're an OB/GYN, you can customize a template for your OB patients. For this demonstration, I'm going to toggle the pregnancy record toggle to indicate a pregnancy, and for the template, I'm going to use just the defaults. You can also pull up a previous note on the left side of the screen if you need to review it. Tap Assigned User to add your name, and then tap Save. Each user working in the note can change this to their own name. Tap on the date to check Visit Type, Responsible Provider, toggle if it is an urgent or emergency situation, and then tap Save. Tap OB in the upper right-hand corner to add or view OB data. Tap Done to return to the chart. First, I'm going to tap on the plus sign to add vitals, and then just swipe right to left to move to the next vitals item. And then click Save when finished. Tap Reason for Visit and fill out. Tap the plus sign to add Chief Complaint. And then Save. Tap on each complaint to add any HPI or History of Present Illness. You can choose free text, standard form, or a predefined set of questions when entering the HPI. Tap Review of Systems and Complete as needed. You can toggle Allergies Reviewed, Problems Reviewed, or any of the histories to show that they've been reviewed today and to make them appear on today's note. Tap Subjective to add any subjective text. Next, tap the Objective icon to switch to the Objective section. Tap Physical Exam and Complete as needed. Toggle Active Medications Reviewed to make the patient's active meds list appear on today's note. By the way, in the RX section on the left side, you can tap the purple arrows to reconcile medications. Quantum ePrescribe does help practices gain efficiencies with the digital transfer of prescriptions to the pharmacies, but it also allows clinicians to access the patient's prescription history with the click of a button. Separately, electronic prior authorizations simplifies the manual prescription authorization process, helping to save time. Electronic Prescriptions for Controlled Substances, or EPCS. That is a certified solution that requires identity proofing to ensure only an authorized prescriber is issuing a prescription. These are all tools to help combat the opioid epidemic. Next, tap on Lab Results to review any recent results with the patient. Tap Objective to add any objective text. Now let's tap the assessment icon to switch to the assessment section. Tap the plus sign to add diagnosis, or you can drag them over from the problems list. Tap Save. Tap on Risk Evaluations to access questionnaires for the Depression Screen, or PHQ-9, or the Fall Risk Assessment. Tap Done to return back to the assessment section. Tap on Assessment to add any assessment text. Tap the Plan icon to switch to the Plan section. Tap the green plus sign to add a lab order. Because we are part of Quest Diagnostics, all past and current Quest Diagnostics lab data automatically updates in the EHR. Tap the plus sign to add any procedures. Tap the plus sign to add any radiology orders. Tap the copy icon and tap Copy Diagnosis to Plan Text. Next to each diagnosis and after the word status, type your plan of care. Tap the plus sign to add any interventions. Tap Patient Clinical Instructions to add instructions to the patient. Tap Future Schedule Appointments to free text any future appointments you wish to have scheduled. By the way, did you know that Quantum EHR has integrated practice management that allows you to view your patient's schedule? Next, tap Education Material Provided and type the name of the material you provided to the patient. Tap Patient Health Concerns to add any additional health concerns the patient may have. Tap the plus sign to add any free text referrals. Lastly, tap Finalize and Sign in the upper right corner when completed. By documenting this full encounter, you're supporting the collection of data for your tracking and reporting requirements, such as MACRA or MIPS. Quantum EHR allows for tracking and benchmarking of clinical quality measures and access to scorecards that help evaluate and identify improvement opportunities for your practice.
Thank you, Justin. We'd like to open it up now for questions from our live audience. Justin, we do have one question that came in here. Documenting a SOAP note on the iPad does look quick and convenient. Does the sync happen in real time with the desktop version of the EHR?
Yes, it does, actually. So as soon as you enter something on the iPad, it'll automatically appear on the desktop version as well.
Looking now, I'll just wait for another moment. Don't have any other questions in just yet.
We now turn our attention to our sponsor, Quantum Practice Solutions. Quantum offers a complete end-to-end solution for all of your practice needs. We focus on the business side of things so that you can focus on your patients. We have the range of technology solutions to support your practice in every way, including those mentioned in the session today. We connect healthcare organizations, community physicians, and patients to improve access to information and insights. Our applications work harmoniously to promote physician loyalty, provider collaboration, and positive patient outcomes. And because we're backed by Quest Diagnostics, you know that you can rely on a stable and proven partner. Our network is strong, connecting over 500,000 clinicians and touching the lives of over a third of all Americans every year. The confidence and reliability that comes standard with every Quest Diagnostics relationship is easy to appreciate and to benefit from. Our holistic suite covers every aspect of your patient and practice lifecycle, from appointments and reminders, documenting a patient visit, verifying insurance and processing payments, and right through integrated follow-ups via our MyQuest patient portal. If you are looking for a complete solution from a single source, we have you covered. Our electronic health record is an ONC-certified, award-winning product that works extremely well with small practices like yours. It is cloud-based with powerful mobile integration to your smartphone or iPad, allowing you to work wherever and whenever it's convenient for you. The practice management side allows your front office to work more efficiently to manage the flow of patients, keeping your practice organized and agile, linking directly to your EHR so that you can spend more time focusing on your patient and billable encounters instead of front office administration. And if you're considering an enhanced medical billing service, Quanum RCM is an outstanding revenue cycle management product as well. Few things are as time-consuming for your practice as billing and collections. Handing off the more monotonous busy work can free your staff to focus on patients instead of spreadsheets. Trust us to provide you with a solution that's up to date on the evolving trends and changes in the industry. If you have more questions about Quantum Practice Solutions, please feel free to call or email using the contact information on the screen. Once again, we thank you all for your attendance today. A special thanks to Justin, and of course Quest Quantum for sponsoring the event. Keep an eye on your email inbox for additional seminars covering related issues in the near future. This will conclude today's presentation.